All right, let's dive into a new NHS policy that's giving some real hope to kidney cancer patients.
Imagine having cancer, but being told there's no treatment. For some, this is a devastating reality.
So there's this really frustrating gap in kidney cancer care, but a potential solution is on the horizon.
For smaller tumors, there are options if you can't have surgery, but for slightly bigger ones, nothing.
And that leaves a pretty terrifying gap. If you're too sick for surgery, you're just forced to wait.
But now, a new policy is proposing a solution. It's a technology called SABR.
Now, this isn't your standard radiotherapy. Think of SABR as a high-precision tool built to just attack the tumor.
So what makes it different? It's super targeted, more powerful, way faster, and safer for healthy tissue.
Okay, so the big question is, does it actually work? Let's check out the clinical evidence.
Get this. One study showed a 98% local control rate. That means the tumor didn't grow back. And another one? An overall survival rate of almost 92% at 4 years. That's huge.
Plus, progression-free survival was nearly 90%. Basically, the cancer just didn't spread.
But, and this is important, we have to be upfront about the evidence. It's strong, but has one limitation.
You see, these studies didn't have a control group, patients who didn't get SABR for comparison.
Okay, so beyond the numbers, what's the impact on actual people, on patients and their families?
When this cancer goes untreated, it really affects a person's entire life, from mobility to mental health.
And that, of course, puts a huge and growing strain on the people who care for them.
But this goes even wider. This policy could be a big deal for reducing health inequalities.
See, kidney cancer hits certain groups harder: older people, men, and folks in deprived areas. And since they're often the ones unfit for surgery, SABR directly helps these vulnerable groups.
So this tech is closing a huge treatment gap, which makes you wonder, what other gaps could it close?